The worst case scenario is that there's a breach, your patient information is leaked, now you have to report it, now you could be fined, now you're viable, your reputation as an organization. That's the apex of nightmares.
Healthcare is the #1 target for hackers, and most clinics and practices are completely exposed. Today, we're talking about what it takes to protect patient data, stay compliant, and not become the next headline. Carlos Castan is the fractional CIO that small healthcare organizations didn't know they were missing. With over 20 years in IT and as a founder of DataWorks, he brings Fortune 500 expertise to the clinics and practices that need it most, helping them tackle cybersecurity threats and protect their patient data. And later, Carlos makes a clear distinction that got my attention. He says that artificial intelligence, or AI, is great, but what beats it every single time is something he calls RI, real intelligence. Stay with us. Carlos, thank you for joining me today. I'm excited to talk to you about DataWorks and the things you're doing in the industry to support your clients.
Great. Thank you, Heath. I'm excited.
So listen, tell me right out of the gate, what's the problem you're trying to solve? What's going on out there that brought you to this decision to provide this service?
Yeah, Heath, traditionally, we've been running into more and more healthcare organizations and clients. And we've identified that as a whole, healthcare is really a technology laggard. And that's really impacting a lot of different areas. It's impacting, hey, listen, direction on technology. How much do we have to budget? Hey, we're expanding. Based on that expansion, what technology and infrastructure do we need? Very, very important. Number two, hey, listen, you got to meet HIPAA and high-tech compliance. And if you don't meet compliance, listen, we've seen clients, fined as much as $900,000 a couple of years ago. So that's a big impact. And then number three, listen, it's healthcare patient information that you need to protect. Cybersecurity, very, very, very important. The bad actors out there are very competent, very aggressive, and healthcare has to catch up. There's no options there. So what we've been doing is we've put together a healthcare specialized IT services stack to specifically address those concerns. And our leading solution or product is our technology stack, which really covers a virtual or fractional CIO to help with strategy and budgeting. Number two, compliance management, which is very, very important and ongoing. Things like, hey, listen, you even have to train your employees on HIPAA every year. And then number three is, listen, let's lock up your information, computers, and people's identities with the right security stack and ongoing services.
As you and I were talking earlier, you're talking about a very vulnerable industry. I mean, there's a lot of data that can be had and hacked, and that's serious. That's a serious problem, isn't it?
Yeah, there's personal patient information, there's healthcare information, social security, credit card information. I mean, it's a real treasure for these bad actors.
Yeah, and then also this world of cybersecurity and cyber threat is fast paced, and it changes daily as they try and weave their way in and out of these systems and breaching walls and security systems that are in place. And then on the other hand, you got healthcare, which moves like a snail in some cases. It's a very slow moving industry, and it doesn't pivot quickly, does it?
No. And then another thing that's very important. Hey, listen, if you have the in-house expertise already to do these things, and if you have the funds and the money to get these things done, it's a different story. Most small, medium-sized health organizations do not have that level of staffing and knowledge in-house, and really are dependent on government funds and really short on income all the time.
Is that where having the CIO sit at the table is really helpful? I mean, maybe not even organizations can afford a full-time CIO, but offering that fractional support, like you were talking about, kind of gives them that bench strength.
You're absolutely right. And our approach is that we try to meet all our clients where they're at in terms of technology and budgeting needs, in terms of compliance support, in terms of cybersecurity support, in terms of, hey, listen, what is your budget? We meet them where they're at.
So where did you come from in this? At what point did you kind of say, this is something I got to deal with? And you've got a long background in this, don't you?
Yeah, I have a BS in electrical engineering. I worked for Fortune 500s for Motorola and Bell South. I then worked to one of the first data communications startups that ever came out. We did a lot of work in Wall Street with communications. And then we basically spread out to wide area networking, data voice integration. We constantly worked with organizations to solve their technology issues. Along the way, I've been probably for the last 20 years a technology practice leader. So I have the technical skills and the management leadership skills to really naturally become a CIO, a competent CIO in my role. As far as healthcare, we in the last couple of years have just been referred to more and more healthcare companies because they've been the most in real need. So they're reaching out to us, they're waving the flag, we need help. So, I like to say I had this brainstorm of healthcare, and I didn't. It was basically addressing the immediate needs that I was seeing. That's really it.
Well, you came from the world of IT, right? And
yes.
IT for traditionally has been kind of about security and protecting, networks, from that perspective. So it seems almost natural that cybersecurity would become a part of that IT infrastructure. But I don't think everyone's taking it all that seriously. I mean, some are, because some have had experiences where they've been breached and their data has been gleaned. But is everyone taking this seriously, or is it still just kind of like, well, I'll wait and see what happens?
Yeah, Heath, unfortunately, your typical small, medium-sized healthcare organization is lean on staff, lean on revenue. The C-suite has got nose to the grindstone, just trying to get that organization to meet its commitments to both patients, the community, monetarily. Unless there's a major issue, they're not going to respond. They're going to strictly be reactive to something major happening. What we try to accomplish in the most professional and persistent manner is we say, hey, listen, the worst case scenario is that there's a breach. Your patient information is leaked. Now you have to report it. Now you could be fined. Now you're viable. Your reputation as an organization. That's the apex of nightmares. So what I try to tell them is, listen, the next worst thing is, listen, be aware that will be happening sooner or later, but there are preventive things that you can do on the front end to mitigate those kind of, critical, terrible situations happening to your organization.
Do they even know that to be fined means you've breached some sort of, or you haven't met some sort of process or regulations? Is there certification or requirements that organizations are supposed to have that they aren't aware of?
Number one, they should be aware of HIPAA and high-tech compliance requirements. They should be compliant, and there's a whole list that HIPAA basically changes that every year, every couple of years. There are changes. You got to stay up to date. If you're not up to date and there's a breach and something happens, then you're vulnerable to being fined. Very, very important. Also, with cybersecurity, listen, even if you have cybersecurity insurance and you're saying to yourself, oh, I've got cybersecurity, I'm covered. Listen, the insurance company, once there's a breach, they're going to come back and they're going to ask you a lot of specific questions. And if even, this little line, you're off, oh, sorry, you're not covered.
Yeah. I mean, that's a risk. That's a big risk. And not only that, I mean, sure, yeah, you got insurance to cover your damages, but what about all the people whose information just got swiped? Right? I mean, that's a whole other, cascade of events that could go on, and who wants to be liable to that? And you said this, it will ruin your brand as an organization moving forward.
I had about a 50, 60 employee healthcare practice, and they were breached. Their data was breached.
Oh my God.
They had to then spend literally close to $100,000 on bringing in this specialized legal attorney team that specializes in cybersecurity breach mitigation. And it went through this whole complex, procedure.
What a process.
And this kind of like a secretive way where they send out notification to clients that they actually were breached, but not, how attorneys are. They could really word it any way they want.
Find anyway, yeah.
Right. But listen, why put yourself in that situation? It's 100% avoidable, because even if you get breached, if you're compliant, you're covered. You're good. You're good.
Yeah. But what you want to do is avoid being breached. That's the whole point. That's the main point, and that's what you're providing.
That's correct.
That sort of that lockup. How do you do it? Is it software that you install, or how is that done?
Yeah. Listen, I'm going to tell you the most unpredictable thing that organizations can do for cybersecurity protection. Train employees regularly. Show them screenshots of typical spams, of typical things they shouldn't be clicking on. It's education, education, education. On the back end, hey, listen, we've got the technology. We've got these special AI algorithms that are looking at things and so forth. But listen, there's very little we can do if we got some crazy end user just clicking on every possible crazy thing.
It's human error.
Yeah. So I'm going to say, listen, 95% to 98% of all these critical breaches are initiated by humans opening up emails and clicking on malicious links they shouldn't be clicking on. And it's just a matter of education. Now, hey, listen, are there very, very sophisticated, third-party international organizations that get into systems? Okay, but we've got some sophistication. We are notified. We have some awareness. That's going to always be a challenge. On the back end, leave that to the experts, right? But hey, when 95% of what's happening is just lack of education from people just clicking and clicking, so that's how we address it. So listen, here's the thing that I want to clarify, right? At the end of the day, AI, artificial intelligence, is great. But you know what trumps AI every day? RI, real intelligence.
Mm-hmm. That's great. I like that. That's a good quote. You should use that more often.
Train your people. Train your people. The AI is on the back end. The RI, use your real intelligence on the front end. That's 95% of the impact and vulnerability.
Someone has to click on that link.
It happens so often. And, a lot of times, these poor people, are unsuspecting, and these things happen all the time.
Mm-hmm. And they're aware that that's what's going on out there. That's why they create these ways of getting in through emails and clicking on those kind of links. And they also probably are quite aware that the healthcare industry is lacking and behind.
Absolutely, absolutely. They're treasures to these hackers. These entities, these healthcare entities. Absolutely, they know it.
Yeah, very interesting. So tell me about your company. You're a little bit more about your company. How long have you been in business, and how's this trajectory of growth been for you as a business owner?
Yes, so our business is over 20 years old. We started in data communications. We evolved in basically data and voice integration. Our clients, once again, came to us and said, Carlos, can you take care of everything for us, our full IT stack? And our company right now, we have a significant staff. We have just a local go-to IT staff of help desk staff of 5. We expand out to 2 different organizations for support. In Pittsburgh, we have 100 techs that are available to complement our team. We have another 50 to 75 techs in Canada, because a lot of companies can only use, especially in healthcare, U.S.-based support. So we have both.
Right.
And then we have a team of about maybe 10 field service technicians. Plus, we work with a nationwide organization to provide nationwide field service support. So we've got it really covered in an expandable manner. We're designed to scale.
Very interesting. And then as far as this CIO position, how scalable is that? Like, how many more people would you need to bring on? More people that are qualified to sit in those seats?
Yes. Right now, I am the CIO for a really rapidly scaling organization. I'm the technology leader for 2 or 3 other organizations, which is just a step below being a CIO. As we grow, we will be bringing in or cloning in Carloses to take on the growth.
How many more Carloses do we need right now?
We really do. And listen, that's the way to do it. Listen, you have a professional services organization, whether it's management consultants, whether it's CPAs, you grow the team. You grow the team.
And it's interesting because you're working on in a very digital world, and yet you're still very focused on the human aspect, the human touch of what's involved here. Not only on your client's end, but from your side of it, it sounds like it's very human oriented. As far as having technicians and people sitting in seats and advising and collaborating.
Yeah, we are seriously already active in developing our AI capability. We want to roll it out. Yeah, we want to roll it out in phases because it can only be brought out in phases. We do not want AI to be making mid-level or critical high-level decisions. At best, it's going to be level 1 type of support requirements and escalation. Level 2, level 3 will definitely be deferred to human beings. And we're looking at different areas where we can actually deploy and grow the AI. One of the challenges is that, we're very, very big in providing differentiated services. And part of providing these differentiated services is we want to train the AI. We want to own the AI. It's our specialized delivery of these services. So that's very, very key to us. So we are proactively working on it and training on it and testing it in different areas. Listen, we want to be, honestly, early followers. We do not want to be burning visionaries because you burn your clients and your business with these burnings. So we want to be early leaders. Hey, look, Amazon 2-3 weeks ago had their operation systems completely overwritten by junior coders that they were using AI for. They had to have like a national, international meeting, and basically what they said, which is now using real intelligence, RI. They basically said, hey, the lower level guys, you can make decisions. Mid-level type of decisions, high-level decisions, you can't program, you can't activate it. You got to run it by the senior guys, right?
Yep.
So
that's where your RI comes in.
Hey, absolutely. Absolutely. So we want to make sure that we roll this out in a way that's productive and provides value to our clients as well as ourselves while mitigating any disasters for both of us.
And it's interesting, too, because we're talking about healthcare that we have already said, it kind of moves particularly slowly. But at the same time, healthcare is also adopting all kinds of new technology like AI and digitized services and stuff like that. So they're adopting some of these things.
Here's my
but there
question.
may be, is there a disconnect maybe?
No. Here it is. 100% healthcare is deploying AI and spending a ton of money and effort. But the horse comes before the cart. They're throwing the AI cart out there, and they really don't know how they're going to really deploy it or benefit. You really have to have, honestly, you have to have business, industry, organizational, subject matter expertise. That's what you need first. Once you have that, you say to yourself, well, how do I use this AI tool to get the outcome that we're looking to get? People don't realize that. Oh, we've got AI agents, we've got this, we've got that. What's the real outcome? What's the real return on investment? They haven't thought that out yet. They really haven't.
No. Yeah, they're looking for ways to streamline their services and, sort of maximize human hours by, automating a lot of manual processes, which is great. But at the same time, do they really understand the complexity of it and how that can even make them more vulnerable, perhaps?
Listen, it could create more work for middle and high level managers. Is it really addressing the requirement that you wanted? Listen, everybody's always caught in tasks and activities, right? Hey, listen, how are the outcomes being impacted, right? That's really, you're spending money, time, and effort. What's the outcome,
So when we're talking about, you were talking about HIPAA requirements, are there other certification models out there that organizations could be reaching for or getting, or is it all sort of based on HIPAA?
Hey, listen, there's healthcare organizations, their main compliance umbrella is really HIPAA and the HITECH Act, that covers it. We're also helping some organizations, not that we actually do it ourselves, but the Sarbanes-Oxley or the SOC. A lot of times they require SOC compliance.
About SOC compliance.
Yeah, and then what we do, hey, listen, we don't know everything. So we basically become the project manager to find and bring in for their industry the appropriate SOC implementer or consultant to basically analyze. But, you need somebody in the middle that knows what's going on.
That's part of your network. Absolutely. You make that connection. You're the networker in that
sense.
Exactly. Yeah, for sure. Yeah.
Exactly. And listen, let me tell you something. You think a CEO, a CFO wants to spend all this time doing this, and they're saying to themselves, this is a requirement. We need it. And they're like looking at themselves and they're like, but I don't know anything about this. Nor should they. They should be spending time and expertise on what drives their business, not compliance technicalities.
Exactly. It's like many other things. You need experts to, you need the surgeon to do the operation. You don't find an IT person to do that, and vice versa. You need to actually hire the right people or bring the right people in. So, and it sounds like you kind of got that end covered. You've got your network of other consultants that can do things that you're not focused on, but you guys are kind of holding the fort.
You know what, Heath? That's such a powerful statement. When you get a really good CIO like myself, you're getting access to my network. And you can say, hey, listen, you may not have the best or whatever, but I can tell you I have people that are referenceable that have been involved and got the job done. How's that?
That proof is in the pudding for sure.
Exactly.
And you're able to work with organizations across the U.S. as well as North America or anywhere else?
Yes, we can. Yes. We predominantly work with New Jersey-based organizations, and I think it's not our limitation. It's just a lot of these healthcare organizations are like, hey, listen, we want to deal with somebody local, so
Right.
predominantly. But, listen, 90% of our work day in, day out is remote, remote access to systems. That's really the world we live in, So, but listen, we just finished a year and a half engagement with a surgical center out of Florida that we did a fantastic job. We brought them from basically, non-HIPAA compliance, non-technology compliance, in like a year and a half. We brought them, to where they are now. They can take it themselves, but they were given direction. They were giving budgeting. We helped them fill out their insurance claims because the insurance companies were asking all types of cybersecurity questions, and these guys were nowhere near being compliant,
Right.
So a lot of it, we were like, okay, we're aware of it. We're in progress, check.
I mean, what a sense of relief for an organization to finally make that commitment, bring yourself in and your team, and to actually know that they've actually crossed that line and said, we feel safe. We feel like we've protected our patient data. We've protected our internal systems. Like, that must be such a relief for someone in an organization to say, we did it. We're done. We've reached the, and then implementing that as an ongoing part of their operations.
Right. Something else, as you were mentioning that brought to my attention, a lot of organizations, you contact them and they're like, oh, we have an IT manager or we have an IT person handling that. The truth of the matter is that these people do not have the technical mental skills to do these things. Just because you're a Band-Aid quick fix person doesn't mean you're a critical thinker.
Right.
You can take variables, evaluate them. How do those variables take you to phase 2, to phase 3? What's the overall process? They basically have, guys that are sticking fingers in dikes. You know what I mean? Oh, there's a dike, stick it. Oh, we got that covered. You're so.
That's what I was gonna say. Like, it's a very reactive. IT is almost a very reactive. You put things in place, but things break, and then things have to be repaired. And IT tends to be, well, historically is like, oh, I can't turn my computer on, and so, or I can't get on the network, or I can't get on the internet. And so IT has kind of predominantly been known as they're the people that fix things in organizations when the technology breaks. But what you're talking about is this is an entire other layer on top of that, which is more of a proactive service and a proactive plan, because you're establishing what are the risks, where can this breach happen, how can this be stolen, and so you're preventing what's going to happen as opposed to reacting.
Yeah, the other thing is financial. You have limited funds. How do you best allocate those limited funds that will make the most impact? You follow me? Using technology to support your business goals and plans. A lot of times there are these, hey, listen, oh, this is critical to our business. Oh, but we used our budget on these PCs already. Hey, listen, give somebody their immediate 6-month plan, give them their annual plan, give them their 2-year plan. Listen, you're going to have limited amounts of money. These are the priorities. They're not my priorities. They're based on your business plan and your growth plan. That's what they're based on.
Very good point. Very good point. I wanted to ask you, so this seems like a very incredible opportunity for you as a business and for growth. And like you said, you're ready to scale. What model are you thinking of doing here? Is this something that you could franchise and create, satellite offices all over the country? Or what do you think is the best way for you to approach this and get the best of reach? Yeah, it's very good. We have that plan already, and the plan is to get additional Carlos clones and strategically position them, the Northeast, Southeast, Midwest, West Coast.
And the model is, the model that's always worked for humans. Listen, have a management consulting firm approach, but it's basically a healthcare technology management firm.
Mm-hmm.
And we plan on taking it to the next level. There's a real need for this over the next few years. And as healthcare is going to continue to grow, right? There's no way out of it.
It's not getting any smaller.
You've got the big gorillas that these healthcare companies have to fight, right? They have to fight the government on regulation and compliance, and then they have to fight the insurance companies. So they're these little guys getting clobbered by the big gorillas. They need help. They really need help.
And there seems to be more clinics, small enterprises coming all the time now, right? Which, they're not these giant companies, but they're small, very effective locations providing very specific services in certain regions. And this is who we're talking about. We're talking about protecting those kind of organizations that are small and yet still very vulnerable.
You are 100% right. Look, here's the truth of the matter. There's a tremendous drug addiction issue, that needs to be dealt with. There's mental health out there that you really, today's society is it's high pressure. It aggravates mental health. And then, having drug addiction issues, having mental health issues, that brings now homelessness and home shelters that are also required. So they're all interrelated. And to me, they're all part of healthcare. They are all part of healthcare, whether you like it or not. That's the full circle of it,
Yeah, absolutely. It's a very good point. And so being able to access these services is critical for them as well.
Absolutely. There's a very, very needy population out there that needs these services, and they're not going away soon. They're going to be there. It's a challenge for us. It really is.
What do you see? What's happening next in your industry? What do you see coming in the future that will either impact or improve situations?
We feel that we're going to be able to get to more healthcare organizations, be able to get to more of them, help them support their populations better. We're going to do it in a more affordable manner. And that's really by using our subject matter expertise to deploy technologies like AI.
Right.
All right. That's the ultimate goal. So it's subject matter expertise, real intelligence on top of everything, and deploying the tools using AI. Listen, we're going to be able to help you deliver these services to your population better, faster, less expensively. We're going to be able to do it. I like to say, I don't know if CEOs or CFOs, chief operating officers, but we want to help them reinvent. We want to help them reinvent what it is to be a healthcare services provider. We want to help them. The technology is there. It's a matter of getting the word out there. And honestly, people like myself doing a much better job of providing clarity on what this means to them. And that's a challenge for me, Hey, listen, I try my best, but it's
it sounds like you're doing a great job, man. I think this is very important for the industry, for the healthcare industry, and you're clearly passionate about it.
Yes,
it's something that you speak very strongly and genuinely about. So I'm sure that other people see that and hear that in your voice when you're presenting it. So amazing to hear what you're delivering here for people. Wanted to also ask you about you lead your company. What is it about you? I mean, we talked about you being passionate and genuine, but what is it about you and your ability that you think is most effective in your role?
What's most effective in my role is, I think, although my background is technical engineering, I've been more and more developing my emotional intelligence, also being able to have intuition about where markets are going, solutions and technology. So having that, I try to be an excellent communicator, and I try to have a very high level of being able to respond, high level of response. I see a high level lacking urgency. I see that as the biggest problem with technical types. They're very focused, they're drilled, but they don't have a high level of response or urgency. And that is important because when these clients who are non-technical, they're down, now they're worrying. Did they steal my information? I had this big project to finish with a deadline today. I can't do it. Your typical IT technology companies, not so much. We have a high level of urgency. So I think it's about vision, intuition, communication, and a high level of urgency.
Yeah, I think that's a great way to sort of differentiate one from the other. So a great observation on that. Yeah, very good. Carlos, this has been such an interesting conversation. Did we cover everything that you wanted to talk about today? I don't know if we've missed anything. But
no, Heath, I think we've done a great job. I really think the mission today was getting the word out about, hey, listen, we understand your industry, we understand your most critical needs, and we're working together on specialized packages to provide solutions to those needs in healthcare.
And someone listening to this, they can track you down on LinkedIn, Carlos Castan, right?
Yes.
And what's the website that they can reach?
The website is DataWorks LLC.com.
And we'll put all those links in the show notes as well. So if people want to track you down, they can. Carlos, thank you again for your time today. This has been a very interesting conversation, and I think this is a very important subject matter that people really need to get behind and give you a call and get this in place, because it's to secure their future and everyone else's information, which is highly important moving forward.
Great. Heath, and thank you for helping us with our mission of helping healthcare organizations. Thank you.
You got it. Have a good day, and thanks for joining me.
You're welcome.